Chapter. My name is Dr. Sarah Wooten, and this is Dog Care and Air. I am the host, and today I am so pleased to bring my guest, Steve Dale, to our viewers. Steve, thank you so much for being here.
Oh, it's great to be here, but you know what? Don't tell anyone. I had an extra serving of ice cream with my lunch, so I look it, and then I'm not taking this off because I have not had a haircut, it feels like, in 12 years.
That's okay. It's pretty much the state of the world right now. I'm not going to show you, but I'm definitely wearing pajama pants right now. So
Show
anyway,
me.
woo! Okay.
You are.
So hey, everybody watching, you are in for a treat today. You are super lucky. We're super privileged. And I am so excited to have Steve on with us. So if you don't know who Steve Dale is, and why don't you, let me tell you a little bit about who this guy is. First of all, he's a certified animal behavior consultant. He is the host of two, not one, but two nationally syndicated radio shows, Steve Dale's Pet World and The Pet Minute. You may have seen him on TV because he's been everywhere. He's been on Oprah Winfrey. He's been on National Geographic Explorer. He's been on Good Morning America. He's been on Parts of the Family on PBS. He's been on Fox News. He's been all over Animal Planet and so many other places. He is also a writer and contributing editor for Catster, and he writes a column called Steve Dale's Vet World for Veterinary Practice News, which is for veterinarians like me. He's also a columnist for the Journal of National Association of Veterinary Technicians in America and Pet Vet Magazine. So you may have also read something that this guy's written. He's been quoted in the Wall Street Journal, USA Today, Los Angeles Times, the Red Book, so many veterinary publications. I've read so many things by Steve Dale. And he's appeared as an expert guest on so many places all around the world. He is also a speaker. He speaks all over the world, internationally, at veterinary and shelter conferences. He's also been at South by Southwest. I had the great privilege of meeting Steve at a veterinary conference in San Diego several years ago, and I can't tell you how excited and happy I am to have you on our show, Steve.
Wow, I am going to record that introduction, and when they allow passengers on the buses in Chicago, I'm going to play that as I get on the bus so everyone knows who I am. Thank you. That's really very nice.
There'll be some fanfare and some confetti cannons, and it'll be like, Steve Dale is here. Right? It's amazing. So, all right.
Nice. Thank you.
So, absolutely. So, Steve, what we want to hear from you about is, obviously, we've all been in lockdown. We've all been at home with our pets constantly, and there's been some concerns about separation anxiety for these pets. So what are some concerns that pet parents might have surrounding ending lockdown and going back to work after spending so much time with their pets?
It's a great question and a great topic. Thank you. Think about your dog. And if your dog falls in one of these three buckets, then I would think about the possibility that it's going to happen to your dog. The good news is you can do something about it, and I'll get to that in a moment. So I'm talking about all of you who are amazing, wonderful people who have adopted or are fostering dogs from animal shelters or rescue organizations. You guys are heroes for doing that. These dogs, perhaps, have never been without a person being there because someone is in the house all the time. So the dogs have had weeks and weeks, if not months, of experience with no one going anywhere. So they're not accustomed to it. What's more, we know that it's likely, he says carefully, that a lot of dogs that are adopted are more predisposed to separation anxiety anyway. So that's one bucket. Another bucket are dogs that have had separation anxiety, and hooray, you have solved the problem. But now, in a way, for some of those dogs, I think, and many of the veterinary behaviorists I've talked to think, it may be starting from scratch. Even if you've solved that problem before, because the dogs, again, have had no practice being left home alone. The third bucket are dogs that are like maybe Sarah, and dogs that are like maybe me, for sure me. Dogs like structure. Dogs like consistency. They don't like change. And now, for reasons unexplained to the dogs, they're not getting an email saying, tomorrow everyone's going back to work and the kids are going to go do this and the life's going to be turned upside down again. They don't know why that's happening. There's no explanation for it, but it will happen. And if it happens just like that, you get that? Like that, overnight, those dogs may have an issue too. And there's no predicting necessarily if that's going to be your dog. If your dog has had, and you know, because you've lived with your dog 8 years, a problem with any sort of change. So Uncle Joe was living with you, and thank goodness he moved out with his cigar smoke as well. And now the dog is like, what happened? And is acting really strangely, even is anxious. Well, that is a clue right there that the dog will have a problem. So if your dog falls in any of those 3 buckets, now everything I'm saying, you, Dr. Wooten, are a veterinarian, and you like data, and I've got none because we've never had this happen before, so we don't know. But given what we do know about separation anxiety, it is predictive that we're going to see more of it for dogs that fall into one of those 3 buckets.
Well, and anecdotally, I feel like I'm already seeing it just even with my own dog who doesn't have separation anxiety, but we've been with her so much. And yesterday my husband left and went down the hill with a couple of our kids and then left me here with one of our kids. And my dog was just acting so weird. And I was like, what is going on? And then, she shook it off in about 24 hours. But even just that was enough to throw her off her game.
I have a question. What's down the hill that he left for 24 hours down the hill?
Well, in addition to being a veterinarian, I am also a restaurant owner. And so
I didn't know that.
It's not an essential business. So it's been very interesting for us weathering this whole thing. But we have restaurants in Greeley. And then we also spend a lot of time up in the Colorado mountains because it's Colorado.
I don't blame you for that. So that's a good thing. So you're thinking, well, what do I do now? So for those that are still at home, which might be most of you, test your dog out. Leave the house. Sorry, everybody go down the hill. Not only dad with, how many kids do you have? But
too many.
Afraid to ask, I think. But take all the 12 kids or however many you have. It's yours, mine, and ours in your family, I guess. But take them all down the hill or out of the house. Don't go far. Just go down the block and back and see how your dog does. But there's more. What I want you to do is I want you to stuff some treats inside, something like a Kong toy, or leave food, really good food, dispersed in different places, or really good treats around the house in different places, and see if your dog scarfs them up. That would be good. Even better would be to do that and also set up a camera. Cameras are pretty cheap now. You can get them on Amazon for like $35. Just a single camera, more than one camera. If you get one camera, make sure that camera's pointed at the door you left from, and lighting is at least adequate so you can see what comes back in the camera. Try to get a camera that shows up on your phone also as an app, so you can actually see what's happening in real time. Again, they are not expensive. If I could set it up, anybody can set it up. They're not complicated to set up, because that way you can actually tell what your dog is doing. And there's another reason why I want those cameras, which I'll get to in a moment. If the food is not scarfed up, or worse, if the dog that is house trained actually has an accident, you find a puddle of salivation when you get back, the door scratched at, pillows destroyed, then you have an issue. That. That's clear. But it may not be so clear. What if the food is just 1 or 2 pieces, the best you could tell, eaten? That's a red flag, if it's a food-motivated dog, that the dog didn't eat more of that food. And that's when it's good to look at the camera. Here's what I tell people to do. I need you to not assume it's separation anxiety. I don't think many of your clients, Dr. Wooten, would diagnose diabetes in their dog or heart disease in their dog. And to diagnose on your own, in my opinion, separation anxiety is not appropriate, actually, because you can look at that video as a veterinary professional and say, the dog's ripping up the pillow because the dog is having a good time doing it, or was never taught to be home alone and doesn't know what else to do, is under exercised, there isn't enough enrichment in the house, and maybe that is why the dog is doing some of these things the dog is doing. But no matter, the dog is not anxious. The dog is barking at the window because the dog is a terrier. Now all the terrier people are going to bark at me, but is self-reinforcing for the dog to do it, and the dog's having a good time. Or maybe the dog is barking at the window because that dog is saying, stay off my territory, and it's a territorial issue and not an anxiety issue. Maybe the dog does have accidents, but only because the dog is not quite as house trained as you think. So for whatever the reason, I think, and you tell me if you agree with me, I think it's necessary, not a good idea, but necessary to show this video to a veterinarian who can then help you with the next steps, like what do I do about it, which I'll talk about in a moment. I'll give you some ideas, but doing the things I'm about to tell you, if it's not separation anxiety, aren't going to help a bit.
Absolutely. A lot of the differences between different types of behaviors can be very subtle. And so I think you're absolutely on point and wise to advise people to not jump to conclusions if your pet starts exhibiting some behaviors that you don't understand, and instead enlist the help of somebody who can help you sort through and kind of curate that information so that you can determine the best course of action from there.
Now, if it is separation distress, there's behavior modification, and that kind of works depending on the dog and depending on the person, because it can be complicated to do. And there are some products as well, or best, do both. Do some of the products and also at the same time do the behavior modification. And I could tell you about both those things. So, yes?
Oh, no, I'm taking notes.
I don't think so. You know all this stuff. Oh my goodness. No. So for behavior modification, these dogs tend to be a behaviorist. Nick Dodman once said the dogs that love too much, and that's about right. They're like Velcro dogs, and they are sticking to family members, and maybe only one or two family members like glue. So yeah, to some extent that's normal. Wherever you go, the dog is generally in the room with the family members. Dogs like to be with their people. That is not unusual. What's more unusual are dogs that are really like attached like a third leg. So it's like you have 6 legs to that person, and all the time. The dog won't typically go off in another room and take a nap, won't typically go off in another room and play with toys when nobody else is there. So what we want to do with these dogs is encourage independence. We want to encourage them to be off in another room, working with a chew toy on their own, so they can be accustomed to being more comfortable and gain more confidence being on their own. Another thing we want to do is these dogs tend to, have you seen those videos where people are wonderful, amazing, incredible heroes that go off to serve our country for 4 years, and then they come back and their dog greets them? You've seen those videos on YouTube, right?
Yeah.
And if anyone questions whether dogs really love, watch those videos. I mean, it's clear that these dogs are more than just a bit excited to see these people. Let's say you, Dr. Wooten, go to the grocery store down the mountain, and then you live on Mount Everest or something, I think, and then come back from your mountain journey, and you're only gone, though, 20 minutes, a half hour, maybe an hour. Maybe you went to get some groceries, whatever, check on your restaurant, steal some food from your own restaurant. Then you come back. And your dog greets you as if your dog has been serving this country and as if you have been serving this country and have been gone for 6 years. Those dogs that are absolutely over the top. Now listen, all our dogs, of course, are happy to see us when we get back, but these dogs are so, I don't know the right word for it. Excited is not the right word. They are so over the top, enthusiastic, and all you did was you're gone for 20 minutes. And these dogs, here's what to do. First of all, those dogs probably have separation distress. Ignore them. How can you do that? So it's hard for people to do. That's why I say the behavior modification is hard. How do you ignore your dog? But ignore the dog, really, until the dog calms down to an acceptable tail still wagging. I'm still happy, but I'm not jumping on you. I'm not screaming literally with joy. I'm happy. Then pet the dog. And the dog's going to start all over again, screaming and doing whatever your dog was, jumping up and down because you gave the dog attention. So withdraw attention till the dog calms down. So what you're doing is you're teaching the dog to be appropriately happy. The other thing to do is we play into it very often. So stop it. So when your husband comes back from his long journey with your 12 kids, you're probably not going to say, "Oh my God, you've been gone for 21 years," at like a Shakespeare play, "Oh, my Lord behest," you're not going to do that. But I don't think that's Shakespeare. But whatever Shakespeare said, you're not going to do that. You're not going to be that excited to see your husband. You'll say, you have food, good, go to the kitchen. So it's different though with our dogs. We play into it and say, "You're acting crazy like you love me. Oh my God, I love you too. You're the best dog in the world. Oh my God, I was gone for 5 minutes. My heart is breaking too." Stop that, because you're actually just playing into it, making it worse rather than making it better. So that and what are called graduated departures. So these things are hard for people to do, hard to comprehend sometimes. Graduated departures get even more complicated. So what I'd want you to do with that dog with separation anxiety is, without any fanfare, except leaving treat for the dog, safe treats for the dog, leave the house. Go down to the mailbox at the end of the driveway, come back literally after 30 seconds. 30 seconds. Ignore the dog pretty much, make a phone call, watch TV, read the newspaper. There's still newspapers. Do something, and then leave the house again. And the good news is we're home. We can do this now. Leave the house again, and this time for 40 seconds. Next time for 30 seconds. Then maybe a minute. Then maybe 2 minutes. Then back it up to 30 seconds. If you're gone for 5 minutes and your dog is acting totally crazy, like you've been gone forever, you were just gone for too long, and you have to back up that time. They're very graduated departures at unpredictable intervals that get longer over time, get longer and longer and longer, but unpredictable. So some of them are longer, some are shorter, some are longer. You get am I explaining this okay, you think?
Yeah, basically it sounds like you are over time helping your dog rewire their brain to not have that behavior when you leave or when you come back. And if the dog is exhibiting any of those signs that you talked about earlier, you've gone too far. You got to back it up a little bit.
So right now I'm in but by the way, rewiring the brain is exactly right, because that's literally what's happening. I'm in my living room now, and we live in a condo in Chicago, and I'm right near our front door, and right outside our door is an elevator. And when the elevator goes up and down, that's why you're hearing the dog in the background say, "I hear that elevator." Mm-hmm. And she's a Chihuahua Terrier mix, so I guess she's doing her job. I don't know. So those are behavior modification ideas. And those are the ones that we know can work if they're implemented consistently, and depending on the degree of separation anxiety that dog has. We know what doesn't work, and what doesn't ever, am I making that clear? Ever work, ever, is coming home and yelling at your dog. And, you find the pillow torn up or something, and I know we're only human, and we're not happy to see a pile of poop in the living room or whatever when we get home. But I will tell you, it's called separation anxiety because these dogs are anxious. So if I go, or even if I don't do that and just come home, do I look angry or do I look like a rapper? I don't even think I look either. But I failed the test on both accounts.
Very angry rapper.
I look like an angry rapper. Okay. So when you come home and you give that dog even the most subtle angry look, we've seen it on those videos, and then people say, I could tell my dog is guilty. No, your dog is not guilty. Dogs don't feel remorse in the same way people do, first of all. Secondly, that was maybe 3 hours ago. Your dog barely remembers 3 minutes ago. That's enough. So the dogs are not feeling guilty. What they are responding to, they are so tuned into us that, well, first of all, clearly if you're hollering at your dog, you're going to get that response. But even if you're not hollering and you come in and your mouth drops because you see poop, dog instantly sees that. So the tail goes between the legs, and the dog's walking away looking, in our words, remorseful, but the dog's actually afraid of being hurt. I'm not suggesting that you've ever hurt your dog before, but the dog is just naturally acting that way, like, don't hurt me because you're mad about something, or don't put me in that, It's truly, and you tell me if you disagree, but truly, these dogs are not saying, I'm guilty, I did something wrong, I know.
They don't build that same association in their mind. Dogs are the best example to humans on how to live in the absolute present moment. They live in the now. And so they are just responding to your emotions that you are emoting to them at that point. They can't tie it to whatever they did a while ago. They just are so, exactly what you just said, tuned into us, that they will change their emotions based on how we're behaving.
True. Absolutely. So there's behavior modification. Then there are products, and I'm going to show you a bunch. Here's what we know from studies, that when you give clients, pet owners, pet parents, more than 5 things to do. So I rattled off, I think, 5 bullet point, bullet point, bullet point. These are things to do. And I'm going to show you 5 products. That's 10 right there. That's a lot for people, which is why one of these products that can do the trick by itself, and you can add more to it, and it's a new product, and I'll save that for last. It's exciting, but yes, I know. It's called the tease. It'll keep you tuned in, or keep somebody tuned in. But to give too much to people to do at once, I think is just difficult. So this has been the talk of veterinary conferences. It's called Calming Care. It's put out by Purina. It's a probiotic. So it's very simple to use. You just sprinkle it on the food, moist food, dry food, it doesn't matter. The dog will get it. And here's what we know. We know that our gut and our brain are interconnected with one another. 10 years ago, didn't know much about that. But today we do. And you're shaking your head yes. And this is actually from human research that's been done. And as I said, when there were veterinary conferences very early in the year to go to, veterinarians were asking me about this, and they were telling me about positive results. And again, it's a Purina product. All of these products can be purchased. You can do it by yourself. You don't need a prescription. But as I said at the very beginning, and I'm happy to say it again and again and again, talk to your veterinarian first, even though using something like this is very safe. This is one of the nutraceutical products that's out there. This particular one is called Zilkene. It's a milk-based product. So like back in the day when your great-grandma had that restaurant, and great-grandma said, when you said, I'm worried, I'm anxious about taking those tests, and she would say to you, have a warm glass of milk before you go to bed. Apparently great-grandma smoked a lot if she sounded like that, but she was right in that it can help ease anxiety, that warm glass of milk. Well, this is a version of that, simply put. It's a very safe product to use. Again, as I say with all of these, talk to your veterinarian first. And the other thing about all these products, you can pick and choose and use them in conjunction with one another. Adaptil, this is the plug-in version, is a copy of a pheromone. So pheromones are naturally occurring chemicals in which species communicate with one another. It's not really through their sense of smell. They sense this chemical. The explanation of that takes too long as to how that's done. But what's important is Adaptil helps to make dogs comfortable in their own environments. And it really does. I mean, all these things really do work. The thing is, what works better for some dogs may work better for other dogs, etc. The other thing about this, it's a diffuser. So it's like plugging in an air freshener type thing, Well, if you have the windows open, it's not going to do the job. So you have to think, about it. But having said that, this is great. And all you need to do is plug it in. This lasts for 30 days. So there's not a lot of work involved in doing it. And it lowers anxiety quite a bit. What I'm so excited about, though, is this. I don't even know if you know about this. It's called the Calmer Canine. And what this does is this little halo-y thing you put over the dog's head like this, and I'll tell you more about how that can be done in a second. And it emits pulsed electromagnetic fields. Isn't that cool sounding?
Super cool.
But it really is, because what it does, what you said earlier, something to the effect about adjusting their brain chemistry, is exactly what we want to do. And when you adjust the behavior enough, so if the dog, through the behavior modification that I talked about, becomes more comfortable staying home alone, then you're actually changing the brain chemistry in the dog. You're doing that by behavior modification, and gradually, as the behavior modifies, you're actually changing brain chemistry, which to me is, wow, that's amazing. Well, this does that directly. So this can work incredibly well for dogs that even have severe separation anxiety. So some dogs are anxious to the extent they may pace a little while. We still don't want to see that by any means, but they're not destructive and they're not happy. They may bark a bit. The sound of the bark, by the way, tells that veterinary professional whether it's a dog barking because I like to hear myself talk because the dog wants to be a radio host like me, or whether the dog is really anxious, So this thing here, hard to see it here, but it's a vest. And what you do is you put the vest like a harness, almost like you would when you walk a dog. You put the vest, it's Velcro you're hearing, you put the vest on the dog. This attaches to the top of it, Velcro and Velcro. It attaches to the top of it. So the dog could wear it. It needs to wear it for 15 minutes twice a day, or you could just hold it over the dog's head as your dog is sitting next to you on the sofa watching TV with you. Either which way. If the dog is running around the house, this thing is going to fall off, Velcro or not. So you don't want to do, fetch the ball, we're going to run, or go out for a run with the dog with this thing on. The dog has to be calm, but nevertheless, what's really incredible about this is that it works. Using some adjunct therapy is safe to use with it. All the other products, behavior modification, for sure. But this really does work. It's again called, I'll show people one more time. It's again called the Calmer Canine. And I really like it because the technology is so safe and so effective. I mean, I have bunches of videos that CC Animal Health, the company, sent me, and you could see these dogs before and after. And it's like, wow, you didn't give the dog drugs? I mean, now I want to talk about that. I want to talk about psychopharmaceuticals or behavior drugs because to the extent that I can, because I'm not a veterinarian, so I'm careful about, I will say this though, they work. They really do. This takes about 4 weeks to kick in, maybe less, depending on how good you are being consistent at doing this, for starters, and also the degree of anxiety the dog has. It can take a little less time, a little more time, somewhere in there. Most of the drugs take about 4 to 6, 7 weeks to kick in. So the drugs take just a little bit longer. Thing is, a lot of people just don't, and I understand, although there's huge value in giving your dogs these drugs. And at the right dose, you're not changing your dog's personality. That's just not true. People think that, but it's not based on anything. It's just not true. Having said that, a lot of people don't want to give their dogs drugs, and I understand that. Also, the drugs can be longer term use than this is. So you're also talking expense, which, I don't know the cost of this. I just don't recall. But drugs over a course of time, will cost more, of course. So I have no problem for more severe separation anxiety. First of all, I never have a problem with doing whatever your veterinarian thinks is right for your pet, because your veterinarian knows more than me about a pet I've never met, of course. But having said that, I never have a problem with drugs. I think that they save so many lives, the fact that we have them here to use. Having said that, there are lots of clients who just won't. And given that we have other options today, the other thing is drugs do have side effects. They are pharmaceuticals. There are no known side effects to anything that I've showed you, except maybe if it doesn't work, your pocketbook, I guess. But there's no known side effect. So that's the other thing.
Well, and definitely with pharmaceuticals, pharmaceutical aids, one thing I love about our profession is we utilize these drugs as aids to help people get their pets to a place where they can do behavioral modification or utilize these other adjunct therapies that you've already shown. The drugs are like a bridge a lot of times. They're like a tool that can get you to a place where you can actually work with your dog, because sometimes the dogs are just too freaked out to even start anything. And in that case, sometimes adding in a short-term anxiolytic like trazodone can be
Absolutely.
really helpful. And it's nice because it's just short-term. And what I like about everything that you're presenting, Steve, is it just gives people more options to have to help their pets.
And what you said is totally yes, yes, and yes. I absolutely agree. And I'm worried about today. I'm worried about right now. If you're unable to pay your rent
Mm.
and your landlord is dealing with it and you have a dog that's barking,
Mm.
maybe your landlord won't be so forgiving.
Yeah.
Maybe your neighbors won't be so forgiving. So, especially right now, we need sometimes quicker answers, and some people do anyway, need a faster solution because they can't wait.
Mhm.
So, what you suggest is absolutely right.
Well, and as a side to that, in the past, acepromazine was prescribed to keep dogs quiet, that are having problems. And I don't recommend that at all. Acepromazine basically mobilizes pets, but their anxieties and their thoughts are still going on. So it's actually, I think it's cruel. I don't think it is a good option. Yes, your dog will just lay there on the floor, but your dog's still going to be anxious and you're still going to have that problem running in the background. So I agree exactly with what you just said, Steve. I think like more than anything right now, all we need is a deep breath
Sometimes, yes, yeah.
because people are really reactive. So speaking of people, can you speak to dog owners who they may also just be experiencing separation anxiety or the thought of being separate from their pets after being with their pets so long? Can you help us out here?
Yeah, I love that. I did I think it was a TV segment that I did, but a good friend of mine who is a political analyst in Chicago, a very well-known guy. And he sent me a text. He said, "Why do you care about separation anxiety in dogs? How about humans? When I begin to leave, I'm going to miss my dog." And I think that's probably true. So I'm no expert in that from a human perspective. I cannot tell you anything about human psychology. But what I can tell you is I think that it's fascinating that adoptions and rescues went way up so quickly when all of this stay-at-home thing began, and it became clear that this was not going to be just a week. It would be many weeks, maybe many months. And part of that, I think, is because, in fact, I have no doubt, it's because shelters and rescues marketed so well, saying, help, we do need help because we're not going to have employees come in and volunteers aren't going to be coming in. So we actually do need the help. But I think it's more than that. I think that maybe innately we know, especially people who have previously had pets, how good they make us feel. And at this point in time, especially as this all began, we really wanted to feel good. And I'm not saying that adopting a pet made us feel good because you were able to tell I adopted a pet. I'm a hero. Yeah, it's a good thing. But I mean, it made us feel good inside, like taking a drug. And I think that the only thing better than Prozac may be having a dog. except there's no adverse response, Not that I take Prozac. But my point is that they're good for us. And I don't have to tell you, of course, that study after study after study has been done all over the world about different ways in which dogs and cats are truly good for us, having a companion animal. They benefit our health in all sorts of different ways. Our brain chemistry actually benefits by having a pet. But I wonder if, I don't know that someone read a story about it, a story I wrote or a story you wrote perhaps, or a story in the New York Times or whatever, and said, I got to go out and get myself a dog, I'll feel better. I wonder if innately we knew that. Do you think that's possible?
Oh, like in our biology, like
Yeah.
in our evolutionary biology, like
Yeah.
in humans and dog. Oh, that's interesting.
Well, concerning dogs, I mean, we evolved with dogs. There's no doubt about that.
That is so interesting. I have not thought about it from that angle, but now that you say that, there may be like, what if humans have like a dog gene that turns on in times of distress?
I actually would not be surprised. So our friend, one of our mutual friends, Dr. Marty Becker, is known to say dogs have gone from the backyard to our house into our bedrooms or something to that effect. I disagree with him, because what we know now is that our Dr. Becker's grandfather, because he's kind of old, Cro-Magnon men, his grandfather was a Cro-Magnon man, right?
You know, I'm going to have him on the show too, right?
Well, it's the last time I'll be on the show. But we do know that Cro-Magnon men actually buried themselves with dogs. They actually slept, and they weren't even dogs yet. They weren't wolves, but they weren't dogs yet. They were in the process of evolving. They were something, and actually slept in their caves or crude huts with these animals right next to them. Now, probably there was a utilitarian purpose. I mean, there weren't space heaters back then, but to think that we trusted them with our infants, and they trusted us with their puppies or cubs. I don't know because they were in between, and they weren't even evolved into, they weren't Cocker Spaniels yet, for sure. And this is Cro-Magnon men. So I'm going back thousands and 40,000 years, and we actually slept beside dogs. So it is no wonder that we have so much in common. It is no wonder that you could try this at home, friends. Look over there. Just keep looking over there. Your dog will too. And it's interesting, great apes won't. So if you look over there and keep looking over there and keep looking over there, a chimpanzee necessarily will not follow your gaze unless that chimp has experience knowing that there's something good over there. You point over there, chimpanzee is going to walk the other way. And genetically, they are more like us than any other species, certainly more than dogs. But yet you point something, point to the ground, your dog is going to look to the ground. Point to the sky even, your dog may look up.
Well, that is so much food for thought. And I can't tell you how much I appreciate you taking time out of your really busy schedule. I mean, you talk to people everywhere, all over the world, to come and share some of your knowledge and expertise with us.
Oh, well, you said food for thought, so I'm hoping that I get a delivery from your restaurant.
We'll send you some steak, Steve.
I'm all over it. Fine by me.
So you can learn more about Steve or follow him. I'm sure he's all over the social media. We'll get you those links. He also has a website, stevedalepetworld.com. We'll get those links from those products that you shared with us, Steve, so that we can share those with our viewers and post those below this video. And I hope all of this has been helpful to anybody who is, obviously we are all in this together. So I hope this has been helpful to you as you transition back to the outside world. And Steve, thank you so much.
It's so good to see you.
Yeah, likewise. All right, I am Dr. Sarah Wooten. This has been Dog Care and Air, and we will see you next time.
Thanks for checking out our content. If you'd like to see more, Please visit our website at dogcareonair.com or any of our social media channels where we're uploading new content on a daily basis. Look for links in the description. And remember, dogs do so much for us. Learn to do the best for them.